Hi, my name is Praveen Narang. Our company name is Narang Medical Limited. We are based in India and we have our offices in China and USA also. I'm the third generation in this business. We are India's number one manufacturers and exporters of orthopedic implants and instruments and hospital furniture. We are well known worldwide. We are exporting to more than 80 countries, and our brand name Net is well known all over the world. Thank you.
Hi, I'm Nancy Valla. I'm the Chief Nursing Officer at American Hospital Dubai. And welcome to Arab Health 2016. What a grand event this is, I tell you. American Hospital Dubai is one of the best, if not the best, hospital in the Dubai area. The reason why is because we provide patient-centric care. All of our physicians are American board certified or Western equivalent, and all of our nurses are well versed in the top-notch quality patient safety goals of the Joint Commission International. We all speak the same language, patient care. The patient is the center of all of our care, whether it's high tech, high touch, the patient is the center. Thank you, American Hospital Dubai.
It's our 10th Arab Health in Dubai this year, and it's always been a great pleasure to be associated with Arab Health. Trivatron has been in the Middle Eastern and African region for past 10 years, and Arab Health has been a kind of event in which we showcase our new products. In keeping up with our new tradition, we also this year are launching two new products. One is the mass spectrometry kits for newborn screening. Our brand Lab Systems, based out of Finland, is the world number 2 in newborn screening, and we are launching the mass spec kits and also showcasing a new to be announced point of birth assay for TSH. And apart from that, Kiran, which used to be in apparels and accessories business, this year we are launching our X-ray equipments. Mainly we are showcasing two of our CM products, which is being launched from Arab Health this year. So Arab Health is a show in which I think it's becoming bigger and bigger every year, and we are proud to be associated with Arab Health as one of the key sponsors for several years now. Thank you.
The Arab Health Conference is a wonderful opportunity for the various players in the health sector to come together from various countries where sharing of experiences happen. The conferences are running, which is a great opportunity for sharing of experiences and learnings, as well as an opportunity for the public and the private sector and the providers to be in one place. The medical tourism in Dubai is growing very fast. Today we are the number 17 on the Medical Tourism Index of the Medical Tourism Association, and we are making strong strides in terms of regulations, policies that guarantee the safety of the patients when they come to Dubai. Dubai is proud that we have provided today the patient's rights and responsibilities, where every patient comes to Dubai would know his rights and responsibilities. We are committed to providing the language that all patients can understand and speak with. We have 110 nationalities that can speak the language of any patient. We're very happy that we have the medical tourism insurance that looks after any complications that may arise for the medical tourist after he leaves Dubai. If anything goes wrong, he can come back to Dubai. His ticket, his hotel stay, as well as his treatment will be on the account of the very small amount that he has paid with the medical tourism insurance. Dubai today, by end of quarter 3, We had around 185,000 international medical tourists, and our total number of medical tourists from inside the country and abroad is 434,000. And we're promoting 7 areas of specialities, mainly for orthopedic surgeries, ophthalmology, cosmetic surgeries, in vitro fertilization, dermatology, wellness and checkups, as well as any other speciality that might not be provided within the provided packages. They can contact us directly and we will be arranging anything that the patient might need. Thank you very much.
Hi, I'm Dr. Michael Abbo, and I'm the head of the emergency department at Al Qasimi Hospital. I work for InterHealth Canada, the company that you see behind me. InterHealth Canada has been around for about 22 years. It started up in Canada, and it was actually a government of Canada that decided to take the medical expertise that the country had and export it to other countries. So they have had probably a total of about 12 projects, all the way from trauma centers, intensive care units, whole hospitals, from the Caribbean all the way up to up through the Middle East. What we do best is we bring in consultant physicians and charge nurses, and we try and educate the current staff to bring them up to certain levels. We've just announced the contract with Al Qasimi Hospital, the new emergency department, and hope to get that up and running in the next 6 to 9 months.
Hello, I'm Balázs from Hungary. We have shoe factories in Hungary, and we are producing sandals, slippers, and beach sandals. But all the products are personalized to the customer's needs and the customer's shoes. Let me show you. This is your footprint. We measured with that machine, and this is your foot, but you didn't pull up your pants. But if you pull out, I see the laser. I can put a laser here. This is totally vertical, and I can measure your ankle of the foot. And for example, if you have a foot like this, the ankles like this, I put material here, and your foot and your body will be balanced again. So this is very healthy. And I put this medial arch and metatarsal exactly what I measured. So it will be, all of the product will be very, very, very healthy. For example, we are producing the shoes, but we produce the insole especially for you.
I'm Dr. Samir Mupan. I'm the CEO of Aster DM Healthcare for Qatar. We started our operations in Qatar in 2003. As of now, that was the first healthcare project in Qatar, the private healthcare project in Qatar. And now we have 6 centers. We also have a hospital which is coming up. Most probably in the next 3 months, we'll be having our 50-bedded hospital up and running. We've been part of, and this Qatar project is one of DM Healthcare's first overseas project. Other than Dubai, this is the first time that we ventured outside, and that was in 2003. We've been part of this Arab Health for the last few years. We've been actively participating in it, and we're very glad to be the platinum sponsors for Arab Health. Thank you.
I'm Vinod. I head the business development in Aster MedCity, Cochin. And basically, Aster MedCity is a coronary care center based out of Cochin, part of Aster DM Healthcare. And we are currently providing 8 centers of excellence, which includes cardiology, neuro, orthopedics, and the likes. And we have a 670 bed capacity there, and we have a second phase where we are planning to add up another 500 beds. We have a panel of eminent doctors from within Kerala and from outside Kerala who have relocated back there, and we are rated as one of the technologically most advanced centers in India itself. And we have a 40-acre campus, and we intend to expand that into a med city rather than just a hospital.
Hi, I'm Kirk Rossi from NASCO. We are a company that makes medical training simulators for nursing schools, university teaching hospitals, emergency response organizations, and the military. And one of the mannequins that we offer is a full-bodied birthing simulator. If you want to come over here and take a look. So this is what we call Smart Mom, and the baby cries. The mom will deliver the baby. It has heart and lung sounds. It has all sorts of different functions. It has a placenta. I don't know if you can show this on TV, but it has a placenta. It comes with a 5-line monitor. It comes with a computer, and it's operated on an iPad. Okay, it's one of the most advanced models in the market today. We also have a whole range of other simulators. One of the more interesting ones is our preemie baby. NASCO is one of the first companies in the world to develop a preemie. It actually has little tiny veins running through it, so you can do suction with it. You see the little vein holes there. This was extremely difficult to do, to make it like this. So we have a preemie. Did you want to hold that? No. Very lifeless. So it's so nurses can learn how to deal with premature children. We make a whole range of injection trainers, IV injection trainers.
Hi, I'm Mohan Nathan, the Vice President of Global Marketing for Transenterix. We are a medical device company focused on surgical robotics. We are very pleased to be at this year's Arab Health, which is going to signify the launch of the first new robotic surgical system from a new company, Transenterix. Our robotic surgery system is called the Alphex Surgical System. It's a multi-port robotic surgery system that allows surgeons to operate with a great deal of precision and care while comfortable and using very precise movement with robotic instruments. So our system is now available here throughout the entire GCC with a CE mark clearance in urology, gynecology, general surgery, and thoracic surgery. So we're very excited to be at this year's Arab Health to bring this new advanced technology to the GCC, and we hope we will be very successful working with some of the top surgeons and hospitals in this very important part of the world.
I am Dr. Yashar Ali, acting CEO, Chief Medical Officer of Canadian Hospital since 2008. Really, CSH started 2005 as a polyclinic with 20-bed day case surgery hospital. Then we expand on 2008 to 200-bed hospital in Diras area, Abu Hail Dira area. Now we are running this hospital by more than 100 specialists and consultant doctors of different specialty and more than 100 specialists and consultant part-time CBD doctors with more than 300 nursing staff and 125 supporting administration staff. We have all the specialty of general surgery and all the specialty of internal medicine and pediatric, neonatology, obstetric and gynae, and major part our concentrate is advanced laparoscopic surgery. We are doing all type of our surgery by laparoscopic surgery, no more opening, all is minimal invasive. Even our spine surgery we are doing by minimal invasive, two type of spine surgery, doing endoscopic spine surgery and micro spine surgery, and of course neurosurgery too. And regarding the orthopedic, also we are doing all our knee and hip and other small joint surgery by arthroscopic surgery. And of course, the major is also arthroplasty, mean hip replacement and knee replacement also. Regarding ops gynae, this is an active department. We are different from others. We are accepting premature babies, those babies on even 24 weeks pregnancy, when the baby around 300-400 grams. Last cases we have triplets with 450 grams babies. So we have all type, level 1, level 2, level 3 neonatology department. And the hospital also have a very unique intensive care and CCU, coronary care unit, and we are doing angiography, angioplasty for cardiac cases. So this is briefly our hospital.
My name is Sasha Sayer. I'm a medical director of Dr. Wagner Group.
and we are just opening a rehabilitation center in cooperation with the Canadian Specialist Hospital, where we are offering a multidisciplinary approach to rehabilitation, and we're expanding the possibilities of rehabilitation to indications which are not known or not offered in the UAE. Until now, the patients had to go to Europe to have a chance to for rehabilitation stay for after cardiac arrest, cardiac problems, cardiac operations, or metabolic diseases, especially diabetes, which is a big issue in this part of the world because of the lifestyle, because of the heat where you cannot do so much exercise outside, which we always try to get our patients to do. And we have a concept, a long-term concept for our patients. That means they can come in right after surgery, right after the operation, or right after the first diagnosis of diabetes, and they can follow through our process of rehabilitation throughout the years to come. Meaning, we have an inpatient possibility with 48 beds, and we also have a possibility for the outpatients where they can exercise in our gym and under medical supervision and be able to get an optimal result for their disease, regardless if it's a neurologic problem, a brain trauma, stroke, or an orthopedic problem, amputation, knee or hip replacement surgery, or spine surgery, and then we follow on to metabolic diseases, as I already mentioned, with mostly diabetes, but we also provide help for other metabolic diseases and eating disorders, because in this multidisciplinary team we have not only doctors, physiatrists, general practitioners, cardiologists, orthopedics, we also have psychologists, dietitians, and occupational therapists that help us and help the patient on their way to achieving the best possible results in their coping with the disease. Thank you.
My name is Ulrich. Hello. I'm the General Manager for Wagner Health and Care here in Dubai. I work for the healthcare sector now for more than 25 years, being a manager in different fields of the healthcare sector. I was director and manager for 5 rehabilitation facilities in Austria during the last years. And now I had the great pleasure starting with this project here in Dubai. We are currently working here with CSH as a partner. We have found a joint venture. At the moment we offer 37 beds for inpatient service, which is quite unique for Dubai.
Hello, I'm Simon Bainham. I work for Howard Warden Estates, and we're a property company. So unusually we're in Arab Health, and you might ask what we're doing here. Well, collaboratively we brought together 16 medical groups to under the umbrella of the Harley Street medical area, and this is our stand, and this is some of our logos at the background. So we've got the London Clinic, Nuada, and various other medical providers who are here under one umbrella, and we've had a very busy few days with lots of people coming around here to promote the Harley Street area as a whole. That, in a nutshell, is what we're doing. It's the first time we've been out to Arab Health. We came last year to have reconnaissance of what it was about, and hopefully next year, if this is a success, and it seems to be a great success so far, we will have 25 to 30 clinics and hospitals with us in Dubai next year. But cross fingers, hopefully that will happen. I don't know if you want to walk around the stand and have a look at other clinics in the area, but are there any questions that you have? No. Okay, thank you.
I am Dr. Anand Yandraj. I am an interventional cardiologist and the co-founder of Attune Technologies Private Limited. I am the Chief Medical Officer and I guide the product development and product management. Now, Attune Technology is a cloud-based healthcare IT company, and it's completely cloud-based, and the entire solution is on the cloud. Now, we deal with hospital information systems, lab information systems, EMR, and PACS. Our core strength lies in the cloud because irrespective of where you are, the product can run as though it is running in your own machine. And integration for multi-locations, for people who have multiple labs, it's extremely easy because it's on cloud. Now, the EMR platform that we have built is another unique platform, right? This unique platform allows the patient to have all their medical data on the cloud, and it also integrates with the hospital's information system, thereby providing complete information from any hospital uploaded to the cloud, available to the patient at any time, anywhere, right? So this unique feature as of now is not available in most places, and we hope the public will adopt this and all the people will start using this technology so that they don't have to carry their medical record anywhere. Now you go to hospital A, which provides you with some information, some images, some x-rays, the hospital automatically uploads it to the cloud. Now you go to hospital B, they upload some information to the cloud. Now you take it to your family physician, he just has to log into your account and he can go through all your records as though they are in his local clinic, right? So this unique feature is available with us. Now today we are launching 2 more new applications, mobile applications. One is for the pathologist, for whom he can authorize reports, go through reports, and comment on reports from his mobile device. Today, pathologists are confined to a desktop system trying to do all this work. So if there are some 20 pending reports which will appear only at 10 o'clock in the night, he has to stay in the lab till 10 o'clock in the night. Today that's not the case. He can go home, spend some time with his family, and then pick up his mobile device and do his work from home and save at least 2 hours a day from this device. We have another application which is called doctor's communication. A significant amount of work for the hospital paramedical staff and for the doctor is wasted trying to communicate with each other. So the nurse has to inform the doctor about a patient's admission, a discharge, a new investigation that has been ordered, an abnormal investigation report, and all these things have to be updated periodically to the doctor. The doctor may not pick up the call, then she has to keep trying again. With our app, there is an immediate automatic notification that goes to the doctor, intimating him about what the communication is, what the value is, and whether it's abnormal or normal, and whether it's critical or not. And he can respond through a message by clicking, just saying OK to the notification. The moment he says OK, the nurse also knows that the message has been read. So in this way, there is a document trail. Everybody knows who has communicated what and what information has been communicated and what the doctor has viewed. So these are the 2 apps that are prominently published today. But I think the core comes when all these things come together and the EMR is used by all the people and all the hospitals at the same time. Then it's the biggest breakthrough in healthcare technology.
My name is Engineer Ivan Savala, representing Willing Engineering in the Middle East. We are an American manufacturer for warning lights and warning systems for the emergency vehicles such as ambulances, fire trucks, police cars, and many others.
Okay, well, my name is Philip Lilburn. I'm a product manager with Sika. Sika is a company which is German-based in Hamburg. We engage in the production and the distribution of medical scales and have done so since 1840. So the company just had its 175th birthday. Since 5 years we also do body composition analysis, and we're one of the few companies, or really the only company, that are doing body composition analysis for the medical field. So collecting data like fat mass, muscle mass, body water, and bringing solutions for physicians and the medical world to help better diagnose and improve treatment in patients.
Alison Attia, I'm Managing Director from Skin02, Australian Doctors Cosmetics from the beautiful Gold Coast city in Australia. And we're here today at Arab Health showcasing our Medi cosmetic products, which is a makeup that acts as a skincare. So we actually began in Australia. It was our Australian heritage, the harsh Australian sun, that helped formulations be what they are today, and so they're developed to help anti-aging as you wear it, to protect your skin from the sun, to help with things like pigmentation, redness, irritation, and they're suitable for all multicultural skin types that we have, like in Australia and similar in the Middle Eastern region. It adapts to your skin tone and it treats your skin while you wear it.
I am Karthik Bhatt. I take care of Dr. Batra's business globally across all the three verticals. And for us, this is one of the fastest growing segment, and Arab Health is pretty important for us. This is the second year we've seen at least a 90 to 100% growth in terms of visitors and participation. In terms of our business, we are now present in UAE, UK. We're expanding to Canada, France, Germany, US, Africa, Bahrain, Qatar. From around 220 clinics across the world, we plan to reach up to around 400 clinics in next 2 years. So that's our ambition. A homeopathy service provider which works across from the entire curative to the preventive to the lifestyle spectrum, and 100% natural remedies, safe and holistic treatment for almost 92 different ailments, which are all the way from chronic to congenital in nature. And we've seen 94 to 95% success across our patients, and we've been treating them for the last 40 years. Around 1.5 million patients is what we've treated. So yeah, we operate in the UAE through a chain of 4 clinics, plus we've just opened our signature clinic at Al Wasl. We are now opening our aesthetic solution which complements our homeopathy, and we have around 52 products in our FMCG range which across skincare, hair care and body care segments helps the entire healing process.